Good morning and welcome to the People's Health Briefing. Roots Community Health Center is a proud member of the Black Culture Zone Collaborative, and the People's Health Briefing is brought to you as a component of the Trusted Voices campaign. We're reporting for the week of August 10th. I'm Dr. Noha Abalada, and my co-host today is Medical Assistant Latrish Pitts. As health professionals rooted in Oakland serving some of the people most vulnerable to getting and suffering from COVID-19, we are here to cut through the noise to give you information you can use to make the choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking in 15 minutes every Tuesday morning of every week and answer your most pressing questions. So please submit your questions in the comments by direct message or by email to admin@rootsclinic.org. We've been getting a lot of questions about essential workers. If I am one or if I live with one, how do I protect myself? We are going to devote this briefing to taking a closer look at essential workers, and we'll answer these questions today. Now, we know that the pandemic is global, but the effects are very different depending on where you are. So we're here to give you up-to-date information about Oakland and East Oakland in particular. First, let's take a look at Alameda County. Now, this is to the best of our knowledge through August 4th, acknowledging here that the state was having some technical glitches, but this follows along the trend of what we have been seeing thus far. Alameda County at 719.9 cases per 100,000, and here you can see the highest 3 cities and jurisdictions and the lowest 3 cities and jurisdictions. Oakland, Hayward, and the unincorporated areas like Ashland and Cherryland have over 1,000 cases per 100,000 residents. And this is compared to the lowest 3 cities, Albany, Piedmont, and Dublin, which are at 213 or less. Now let's take a closer look at Oakland. Here you can see Oakland at 951 cases per 100,000 residents. But as we take a look at the top 3 zip codes, they are all located in East Oakland, 94603, 94601, and 94621, and they all have well over 2,000 cases per 100,000 residents. This is more than double the average for the city of Oakland. So the bottom line is the virus is hitting Oakland harder than other parts of Alameda County, and it's hitting East Oakland even harder. This is why Roots Community Health Center continues to test large numbers of people in East Oakland. So what are we finding? You may recall that in our first People's Health Briefing, we reported an alarming uptick of the number of people contracting COVID-19 through parties and gatherings beginning in late June. We are still seeing that uptick. However, when we look at the totality of positives from late April to the end of last week, here is what we're seeing. This graph looks at 643 people who tested positive, for whom we were able to determine the most likely source. As you can see, household spread is still the main culprit at 40% of total cases coming from inside the household. Next is through workplace spread. The workplace has been the second highest source, accounting for 30% of positive cases. Overall, parties and gatherings are now at 22% for the 4-month period, and this is the only category that is sharply rising while the others remain more stable. As you can see, essential activities and public transportation are also represented here in smaller amounts, but still important likely causes. Now I'd like to drill down further into what we are seeing with regards to workplace transmission. When we take a closer look at the 187 people whose most likely source was the workplace, here is what we found. 35% of positives were in the construction sector. 22% were in food service and distribution, and 14% were in retail, primarily grocery stores and food markets. And of note, despite being at high risk of exposure to COVID-positive patients, healthcare workers only accounted for 3% of our positives. In case you are wondering if this information is a bit skewed by who is getting tested, we wanted to also show you the number of people we are testing within each of these sectors compared to the number who are positive. This slide shows you the number tested and the number positive by the top 7 sectors that we have tested. As you can see, Out of the people we tested thus far, 41% of those tested in the construction industry tested positive, and just 1% of those tested in healthcare tested positive. So what does this mean? Well, it would take a lot more rigorous analysis and follow-up to come up with anything conclusive, but here is our best thinking at this time. Regarding healthcare workers, first, I want to commend healthcare workers for getting tested in large numbers. We know that if we catch COVID, not only are we and our households at risk, but so are our patients who depend on us for good health. We believe that the low positivity rate has everything to do with workplace protections, proper PPE and infection control practices put in place in the healthcare industry. When the U.S. was caught unprepared and there were PPE shortages early in the pandemic, we lost hundreds of brave healthcare workers working on the front line of COVID, especially in parts of the country that were hit the hardest. We believe that the relatively low positivity rates we seem to be experiencing here let us know that PPE and infection control practices work. I also want to take a moment to shout out all of the operations staff here at Roots, as well as all of the environmental services workers and maintenance and janitorial staff supporting us out there. We know that your jobs got a lot harder and a lot more risky because of COVID, and we owe you a huge debt of gratitude for keeping us safe now more than ever. Now, regarding construction workers, cleaning, janitorial, and grocery and other industries, especially those working with the public where we are seeing a majority of positives. Again, we would need a deeper analysis to draw definitive conclusions, but based on interviews with positive patients, here is what we are noticing across these sectors. Many essential workers did not have proper workplace protections before. They still don't. They did not have enough PPE, like eyewear or masks before, and they still don't. When outbreaks at workplaces occur, employees are often not notified, and the outbreaks are not managed. When staff call in sick or call off in order to isolate because they were exposed, many are told they will lose their jobs. We are concerned about the number of people being asked to work without proper protection when they should instead be isolating or on quarantine. So if you work in one of these sectors, or really any sector where you are working in a confined space and or working with the public, you need personal protective equipment. A mask, probably an N95, and probably eyewear as well. And it really defeats the purpose of wearing an N95 or any mask if you pull it down every time you talk or yell. And I've seen this quite a bit. That's when you really begin to spray. So put your mask on, put your eyewear on, and leave them on. If you're an essential worker, ask for the proper PPE and keep it on at all times. And don't think that when you get off work, it's okay to take off your PPE and then carpool or hang out with your coworkers without masking and distancing. This is the difference between one of you getting COVID and the entire crew being out. Mask up, space out. If you live with an essential worker and you don't believe that they are taking these precautions, you may want to consider universal masking in the common areas of your home. Now going back to most likely sources, you'll notice one thing that's not here: protests. And I want to say a few words about protests. Here are a few pictures of Roots staff participating in protests in the month of June. So while we were standing in solidarity, as healthcare workers, we were also concerned about the spread of COVID. But for the most part, what we saw was Oaklanders protesting, wearing their masks, and being responsible while making their voices heard. We want to commend you all for that. Now, at our testing site, we tested about 36 people who wanted to get tested due to being concerned that they might have been exposed to COVID at the marches and protests. We also want to commend you for doing that. And I'm pleased to report that not a single one of those individuals tested positive for COVID-19. Keep in mind that this is from Roots data only, but out of 974 positives, to our knowledge, not a single one was from protesting or marching. So wear your masks, keep your distance, and keep making your voices heard. As we've said at each briefing, without a cure or vaccine, the best tools we have are mask, distance, test, isolate, and contact trace. And now my co-host, medical assistant Latrish Pitts, will go into more detail about essential workers.
Thank you, Dr. Noha. Good morning. I'm Latrish Pitts. I'm a medical assistant at Roots Community Health Center, and today I will be talking about being an essential worker, how I protect myself, my household, and tips for you to protect yourself and your household. Essential workers risk exposure to COVID-19 every time they report for duty. And they risk bringing the virus home and exposing their family to risk every time they return home when their shift is done. It's a legitimate concern, and it can add to the stress essential workers feel as they do their parts. That's why it's important for essential workers such as myself to provide some helpful guidance and tips. Do's and don'ts for workers. Do. Wear a mask at all times, preferably an N95 mask. Social distance. Stay at least 6 feet away from others when you must go into a shared space and as work duties permit. Frequently wash your hands or use at least 60% alcohol-based hand sanitizer when soap and water are not available. Avoid touching your eyes, mouth, and nose. Do not share phones or headsets or any other objects used near the face. Don't congregate in the break room or other crowded places. Do not share food, drinks, or utensils. And don't bring your work home. So the saying goes. It has taken on a whole new meaning for essential workers during the outbreak of COVID-19 coronavirus. Before you enter your home, follow these few steps to keep germs out your home. Place shoes in a garbage bag or leave them outside the home. And have a pair of house shoes by the door to change into. If possible, set up a place to isolate any items that cannot be washed and or you do not want to bring indoors. Immediately remove your clothing and place it in a designated hamper by the door. Use a garbage bag to line the hamper and wash the clothes immediately. Wash your hands often with soap and water for at least 20 seconds after you have been in a public place or sanitize your hands. Do not prepare or eat food or drinks with unwashed hands. Clean keys, cell phones, and any other items you have been carrying throughout the day with disinfectant wipes. Some healthcare professionals even suggest showering immediately upon returning home to make sure no dangerous germs are still on the body. Normal routine cleaning within the home, such as wiping down door handles and light switches near the entrance, will decrease how much of the virus is on surfaces and objects, reducing the risk of exposure. Each week, we will address some of the widespread myths about COVID and bust those myths with the best facts as we know at the time. If there's any information out there you want us to report on, you want to know if it's fact or fiction, submit your questions on Facebook, direct message us, or send us an email at admin@rootsclinic.org. This week's myth. Sanitizer or bleach can kill the virus in your body if you drink it. This might sound crazy, but just last week, the CDC had to issue a warning about this because around the world, people have actually been hospitalized, gone blind, and even died from drinking bleach and swallowing hand sanitizer, thinking it was a cure for COVID-19. Bottom line for this week's Mythbuster, good hand hygiene and disinfection of surfaces are important parts of the fight against COVID. But please, please do not ingest sanitizer or disinfectants. They can cause blindness and even death. Now back to Dr. Noha for some final words.
Thanks for that, Trish. Now here's our best advice one more time. COVID-19 spreads easily and rapidly within households. The best way to keep COVID-19 out of your home is not to catch it. If you are an essential worker or conducting essential activities, mask up and space out from everyone, including your coworkers. Avoid confined spaces and learn to talk and holler with your mask on. Get proper PPE for your job, and for construction workers and those who will be within 6 feet of especially potentially unmasked members of the public, this might just mean an N95 mask. These masks can be reused so that we save them for healthcare workers, but we need all sectors to invest in the proper PPE for their industry and circumstances. This concludes today's health briefing. Please submit your questions in the comments, direct message us, or by email at admin@rootsclinic.org, and we will address them in upcoming briefings. Please tune in next Tuesday at 10 a.m., and thank you for watching.